knock. Hello, my name is Dorota and I will be your nurse today. How are you doing? Okay, I'm gonna perform the hand hygiene and provide for the privacy. So today I will perform head to toe assessment. Are you okay with that? All right. So I'm gonna ask you a few questions. What is your name? Okay, and the date of birth. All right, I'm checking the band for the name and the date of birth. That's correct. Could you tell me where you are? Okay. Do you know why are you here? Okay. Do you know what is the date today? All right. And could you tell me who is the President of the United States? Okay, so my patient answered correctly all of those questions, so I'm gonna document this as oriented and alerted times 4. Now I will proceed into collecting vital signs like blood pressure, heart rate, respiratory rate, and oxygenation if there is pulse ox available. And I will ask the patient about the pain on the scale from 0 to 10, with 0 being no pain at all to 10, the worst pain ever. Are you in any pain? Okay, so my patient is in no pain right now. I can also collect weight of the patient and the height, and I can calculate the body mass index. And my patient has normal body mass index between 18.5 and 24.9. So while I'm assessing my patient right now, I'm also looking at the patient and collecting data, which is important. I'm looking how the patient is behaving, how is the patient responding, is there clear speech or is there's a slurry speech, can the patient hear me well, does it take for him to answer a little bit longer than normal, do I have to repeat myself, how is the demeanor of the patient, is the patient depressed or do I see anxiety. I will also look at the skin of the patient. Is the skin dry or it's wet and clammy? Do I see any cyanosis or jaundice? I will look at the respiratory effort of the patient while he or she is talking. And then I will check for any abnormalities. I will look at the hygiene and any abnormal smells. Okay? So now I will start the head to toe assessment. So I'm looking at the head of the patient, and is it the head in the proportional to the rest of the body? How is the facial expression? Do I see any drooping on one side like in Bell's palsy or a stroke? Is there any thick involuntary movement of the face? Are the eyes and ears aligned? And is the nose in the center? Do I see any cyanosis on the lips? And now I can test the cranial nerve number 7. I'm going to ask the patient to smile, frown, close eyes tightly, and puff up the cheeks. So this cranial nerve is okay. Now I'm going to wear the gloves. And I will palpate the cranium. So I'm palpating for any abnormal masses and lesions, and I will check the back of the head, especially in the immobile patients, because that's where the skin breakdown happens. And then I will check the hair for any lice infestation or area of baldness, alopecia. I see none, so I'm going to take off my gloves and perform the hand hygiene. I'm looking at the face, I'm looking at the eyes, eyebrows, eyelids. Is there any swelling in the eyelids? Are the pupils equal in size? Are they aligned, or one is in the center and one could be to the left, right, up or down? I will check the conjunctiva to see if it's pink and shiny, because I can check for anemia right here if it's red and swollen. Then I'm going to perform the eye exam. So I'm going to dim the lights, and then I'm going to ask the patient to stare at the wall, and I will shine the light. And I'm looking for the constriction of the pupils. Now I'm going to turn the lights back on, and I will ask the patient to stare at the wall again, and then I'm going to say, please look at my pen, and I will bring this pen to the patient's nose, and I'm looking for the pupil's constriction and accommodation, the crossing of the eyes, so I can record this as PERLA, pupils equal, reactive to light and accommodation. Also, I will check the cranial nerve 3, 4, and 6. I will ask the patient to follow my pen when I'm making a letter H. I'm checking for the 6 cardinal cases of field, and I'm looking for the shaking of the eye while I'm doing that. So it's about 12 to 14 inches from the patient's face, and I'm moving my pen, and please follow my pen, don't move your head. So my patient did that fine. Now I will be looking at the nose. I'm looking if it's in the center, if the septum is in the center. I will shine my light inside of the nose and see if the septum is in the center, and if there's any drainage and the polyps in the nose. Now I can test the cranial nerve number 1, which is olfactory. I would give the patient something to smell and ask what is the smell. So I will bring something to the nose, and my patient did that okay. I can check for the patency of the nose, so we're going to push on one nostril, and I'm going to ask the patient to blow the other nostril. So this is patent. Now I'm looking at the mouth, and I'm looking at the lips if they are, if I see any cyanosis or paleness. There should be pink and clear. I'm checking if there are any lesions on the lips, and for this exam I'm going to wear gloves. I'm going to ask the patient to open the mouth, and I'm going to look at the tongue. If it's pink and shiny, if it's red and beefy, then this could be a pernicious anemia. And I will check under the tongue for any cancer and lesions. Then I'm going to ask the patient to open the mouth and say ah, and I'm testing a cranial nerve 9, and if the uvula goes up, then this cranial nerve is intact. Hypoglossal nerve, that's a hypoglossal nerve. And also I will ask the patient to stick out the tongue and move tongue left to right. This is cranial nerve testing. I'm looking in the mouth also for the, I'm assessing the teeth. Are there any cavities or missing and loose teeth? I'm going to use the spatula to test the gag reflex. So I'm going to put it deep on the tongue, and I'm testing the gag reflex. He has the gag reflex. So the cranial nerve 10 is intact, also because he's able to talk to me without any hoarseness, and he's able to swallow. Then the vagus nerve is intact. Now I will palpate the temporal artery, +2. I'm going to palpate the sinuses, the maxillary. They should feel pressure but no pain. and the frontal sinuses. Next, cranial nerve. I will test I will ask the patient to close the mouth and keep it tight. I'm gonna palpate the masseter muscle and temporal muscle, and I'm gonna ask the patient to move the head from left to right against my hand. Okay, this cranial nerve is intact. I'm gonna also look at the ears. If I see any redness or swelling, I'm gonna palpate on targus and mastoid process. Okay. Now I will check the tympanic membrane if it's intact. So it should be shiny and pearly, and cone of light should be at 5 o'clock in the right ear and at 7 o'clock in the left ear. So I'm checking both ears. So the ears look okay. Now I'm looking at the neck, and I'm looking if the trachea is in the middle, and I'm looking if there's any lumps, if there's a goiter, enlarged thyroid. I see none. Now I can palpate the trachea in the middle, and I'm palpating for the thyroid gland, and now I can palpate for bring up the bed. Okay. I'm going to palpate the lymph nodes, pre-auricular, post-auricular, parotid, occipital, submental, submandibular and submental. I'm looking for any masses and hardness. Then I'm going down into jugular and above the clavicle. There are no enlarged nodes. Now I'm going to bring the patient. Patient is already in 45 degrees angle, so I can look at the neck for the JVD, jugular vein distension, and I see no pulsating. Now I can listen. First I would check the pulsation of the carotid artery, one side at a time. Now I will listen with the bell of my stethoscope for any swishing, number three, on both sides. Okay, I hear none. Now I will move on to chest, to the heart sounds and the lung sounds. So first I'm looking at the chest, and I'm determining if the patient has any trouble breathing, if there is any use of the accessory muscles, and if the patient has a barrel chest, like some patients with COPD. So I would look at the posterior anterior diameter. And now I can assess the lung sounds. I'm going to start with the heart sounds. So I'm going to check the valves. With diaphragm, I'm going to listen to the aortic. It's the second intercostal space. Aortic, second intercostal pulmonic, Ayres point, tricuspid, and mitral. And this is also the place for the apical pulse, where I listen for the whole full minute. And then, after listening for a whole minute, I'm using the bell of my stethoscope and I'm going back, listening to murmurs, so mitral, tricuspid, herbs, pulmonic, and aortic. Okay, I hear none. Now I will assess the lung sounds. I'm starting from the top of the lungs, they're about the clavicles. And then I'm going to the second intercostal space, assessing the upper lobes. I'm going to the fourth intercostal space, assessing the middle lobes, the right, and the upper on the left, and the sixth, assessing the lower lobes, going under, and the bottom on the sides, and the lung cells are clear bilaterally. Now I will proceed to the abdomen. So I'm gonna lay down the patient. So I would like to ask you, how is your bowel movement? When was your last bowel movement? Okay, it was yesterday. Was it normal? Okay, how is your urination? Do you have any problem starting the urination? I would ask this the male patient because they might have those problems with the prostate issues. Is it burning while urinating? I would ask the women when was their last period and if they're pregnant. Now I will look at the stomach and abdomen. And I'm looking for any masses and abnormalities. I'm looking for the aortic pulsation between the umbilicus and the occipital bone. Xiphoid process, and I see none, so I can listen to the sounds first before I palpate. So I'm starting on the right lower quadrant, and I'm listening for 5 to 30 sounds per minute. If I hear none, then I have to listen for 5 minutes. So I'm now moving to the upper right quadrant, left upper quadrant, and left lower quadrant. All sounds okay. And also I can listen to the aorta now with the bell of my stethoscope between umbilicus and xiphoid process, and renal arteries below the umbilicus, inguinal, and femoral. And I'm listening for bruit. I hear none. Now I will palpate slightly the abdomen, about 2 centimeters deep, and I'm looking for any pain and complaints from the patient. And now I'm going for the deep palpation, about 5 centimeters, and I'm feeling the organs of the abdomen, liver and spleen. Okay, there's no complaint here. So now I will move on to the extremities. So I'm gonna look first and for any abnormalities, any redness, swelling. I'm gonna ask the patient to move the joints of the hand and the wrist and the elbow, and move the shoulder if this brings any pain. I'm looking at the color of the extremity also. Now I will check the radial on both arms. I'm expecting both extremities. This one we have amputee here, no right hand. So now I'll be checking the radial pulses, the brachial pulses, and radial pulses at the same time. They're +2 bilateral. I'm looking at the fingers. If I see any cyanosis or clubbing, I'm going to check the capillary refill. Should be less than 2 seconds. And also I'm looking at any nodes on the hand. This could be arthritis. And I'm going to ask the patient to squeeze my arm. And the strength is +5. And then I'm going to ask the patient to push against my hands. And also the other way, push against my hands. The strength is +5. Okay. Now I'm going to move down to the lower extremities. So I'm again looking first for any abnormalities. Here, if I would see any IV or PICC line or central line, I would also assess this for redness and swelling and infiltration. Now I'm looking at the legs. I'm checking for the edema. I see none. I'm asking to move the joints. And the toes. I'm checking for the bilaterally for the pulses, popliteal, pedis dorsalis. I'm checking for the pulses here, tibial posterior tibialis. I'm looking at the toes. Do I see any necrotic toes? Do I see any fungal infection? And then I'm checking the capillary refills on each toe. Now I will test the strength of the patient. I'm going to ask the patient to push on my hands. Now also toes to your nose, please. Just pushing on my hands this way. And I'm going to ask the patient to try to bring up the leg, testing the strength. Okay. And the last thing I can test is the Babinski reflex. And it's normal. Abnormal is fanning, and he curled down his toes. So that concludes my assessment. Thank you. I'm going to bring down the bed and make sure that the patient is comfortable and he has the call light in reach.